Good morning.
Good morning.
I guess I'll keep my green background in honor of the Green Day.
I think Patrick's Day for you.
Yes. All right.
Athena, how are you doing?
I'm good.
It's nice seeing your face.
I know, it's fun to feel connected even though we're so far away.
I know. So your family's healthy?
Yeah, yep, we've been good. My husband got the COVID shot a couple weeks ago.
Okay.
So we're halfway there.
You have video. That's good. And the little one, God, how old is he now?
I know, he's 3.5, which is
Oh my
so crazy.
God. Oh my God. So mobile, running around, keeping you busy.
So much energy.
I know.
Yeah, he's good. He's good.
All right, I will go ahead and share my screen.
Mm-hmm.
Okay, are you guys seeing the PowerPoint?
Yes.
Okay. So let's see, it's 8:28.
I know.
Kind of interesting, right? It gave me a warning when I signed in that I was actually signing like to an external agency, and it asked for a password, which is never done before. So I don't know if that's being like a extra barrier.
Oh, maybe. I bet it is. I bet it is. Okay, thank you for telling me that.
Yeah, the password is in the email you sent out yesterday, so I quickly had to look up too. But yeah, it said the same thing. Mm-hmm.
Athena, did you find the password then to get in?
Yeah, it was in the email you sent yesterday, but it's just never done that before, so I'm guessing some people might.
Yeah, yeah. I wonder if I can change that. I don't know if I can.
I don't know if you can once the meeting started, but
you might want to watch your emails, Mindy. Maybe people are trying to email you.
Right. I closed my Outlook because it sucks. it sucks bandwidth. No one has emailed yet, but it is just 8:30. Let me make sure I have the close that. No, I don't in that. No. Let's see. How do I get the password? Meeting info. Encryption is enabled. Copy link passcode. Okay. People are coming in, so that's good. Maybe I'll quickly send out that passcode. I did make a couple of changes yesterday, but I thought they were actually reducing barriers, not creating them. I definitely didn't do anything with the passcode that I'm aware of. Okay. The Zoom stuff, you know, it's ubiquitous, but it's not necessarily intuitive.
That's true.
I had to hunt for the connection to get in this morning. I swore that Zoom put it on my calendar, but I still had the the GoToMeeting on there. So I knew I had received an email from you, so I had to dig for the email.
Yeah.
Finally found it, and then I had the link. So anyway.
So you were looking for both the link and the passcode?
Well,
Mindy,
no,
it's-
because the email that you sent that was, in our standard UCCCN, nice memo format had the link and the passcode and all of the rest of it. I just thought I had it on my calendar instead of in my inbox.
Okay.
So I don't know. Somehow it did not translate to putting the meeting over onto my calendar as an ongoing meeting. So
Okay.
anyway, now I know.
Yeah, the calendar invites is still using the GoToMeeting info. So
Boy,
that's
and I know we updated that. So I'm not
Mine
sure.
is the GoToMeeting too. Mhm.
That happened to me too. And then passcode as well, which was
Okay.
new.
Okay, we'll get on that. We'll get on that. Many apologies. I just sent out the passcode, but that doesn't help if you're trying to go to GoToMeeting.
Or to Zoom.
And you don't know what you don't know. We just got Zoom, a state account as well. And it took me forever to figure out how to, just make it be something I could choose as an option when I set up a meeting. So it's going to take some playing with to get used to, I think.
Yes.
For most of us.
Yes, and if everyone could just decide on one platform, then I could spend the time and really learn it. But they're not doing that for some strange
Right.
reason. Well, no one's emailing me. I think they're all just trying to dig through. Hello, everyone who's joining. Our apologies for the confusion, the obvious confusion that we've created. So we will take care of that ASAP for future meetings. Yeah, 10 participants. That's definitely lower than usual at this point.
Maybe everybody's out celebrating St. Patrick's Day.
With their green masks on. Does look like a pretty day. All right, well, I'm watching my email, but I'm not seeing folks asking, so hopefully they're figuring it out.
so Mindy, I just clicked into the GoToMeeting link in the current invite and it's showing, it essentially is putting them in a waiting room. So they might be
Darn it.
waiting.
Okay. Yep. I don't know if let's see, I don't know what I can do there. I guess I might have to fire up my email. All right, guys, I'm going to stop screen sharing.
Okay.
I'm going to see if I can. I don't even know if I've got that anymore, to be honest with you.
I can forward it to you.
That'd be great.
I'm also happy to pop in there and let everybody know they need to look for the invite. Do you want me to pop in there really quickly, see what I can do? Because that was still on my calendar.
My guess is that you'll be stuck in a waiting room too, and you won't be
Oh,
able
because
to
I'm not the grand poobah of the room. Gotcha. Okay.
I do think of you as the grand poobah, but not of my.
Well, as well you should, but I'm maybe not with where technology here is concerned. So.
All right, my Outlook is taking forever to fire up. Technology. Okay. Original appointment. Let's see.
I could do, let's see, I was trying to think if I could do a quick reply all to the email as well.
That would be great.
Okay.
That would be great. But I'm also going to try and get into the GoToMeeting. Yeah, now people are emailing. Now they are. Yeah, interesting. Okay. I'm I'm hearing more ding dongs. That's good. Join when session starts. I think I'm in the same waiting room. Darn it. That is not going to work. All right. Well, we're going to bail on that and send out an email about the Zoom.
I'm on it, Mindy. I've almost got it done.
Thank you. Yep, I'm in the same boat. We don't own GoToMeeting anymore, so I can't do anything different. And I don't know. Yeah, I've got the Zoom one on my calendar, so I'm not sure what happened. We will dig into that.
Well, when I tried to get into the GoToMeeting, it said, you don't have this program on your computer. I'm on my Mac this morning instead of my regular computer, but I can always pull up my own, stuff. So anyway, it doesn't want to let me in regardless.
Yes. Yeah, no, it shouldn't. Yeah. So let's see, maybe I'll just quickly read some of these emails, see what we're seeing before I close up Outlook again and we move forward. Yeah, everybody's in. Okay, someone was just not going to be able to make it, so that's okay. All right, I think I have responded to the emails I got. All right, well, let's go ahead and move forward. And I will share my screen. I got a chat. Good morning. Good morning, Natalie. All right, I feel like we're getting there. I feel like it's happening. Okay, is everyone seeing my PowerPoint? Great. Okay. All right. Well, we are recording. We've recorded all of that. So that's terrific for posterity and anyone who wants to watch this going forward. And my sincere apologies to those of you who have managed to find your way here this morning. We clearly have some miscommunication that we need to take care of. I think you've been going to your calendars, your email calendars and clicking on an obsolete link, taking you to an account we no longer subscribe to, and that's not helpful. So we will work on getting your calendar updated appropriately, but we are using Zoom now. So that's why you couldn't get in if you went to GoToMeeting, and hopefully we won't have these problems in the future. And many apologies to those who are still struggling, who aren't on yet. Okay, so we're a little bit behind, so we're going to go a little fast. We're going to do introductions here quickly, and then we've got some brief announcements and updates, and then we'll move on to our brainstorming part. And then we have our main presentation today that is from the Utah Association of Family Support Centers, and that'll be the bulk of our meeting. And so let's do some introductions. Let's see how I can see all of you. 23. All right. Well, as you guys know, I am Mindy Tueller. I am the manager of the Medical Home Portal, and I facilitate this meeting and have done for a long time now. I think we're in our 7th year, which is kind of hard to believe, and just happy to have you all here. I'm going to try and go through quickly who I see on my list. If I miss someone, maybe somebody can help me know that I've missed them. And then if we skip over you, I'm really sorry about that. All right, so Gabby, I see you next.
All right, hi, my name is Gabi Baragoshi, and I am a quality improvement coach at UPIC, which stands for Utah Pediatric Partnership for Healthcare Quality Improvement. And yeah, that's me.
Thanks, Gabby. Athena.
Hi, I'm Athena Parker, and I'm with the Medical Home Portal.
And Brooke Christensen.
Hi, this is Brooke Christensen, care coordinator with Utah Valley Pediatrics in Saratoga Springs.
Great. And Chuck.
Hi, it's Chuck Norland, general pediatrician at the university and director of the Medical Home Portal.
And Dora.
I'm muted. Hi, I'm Dora. I am the professional relations coordinator at Shriners Hospitals for Children in Salt Lake.
Welcome.
Thank you.
Eric.
Good morning. I'm Eric Christensen. I am the program manager with Utah Department of Health Integrated Services Program.
Terrific. And I'm seeing a telephone number, 768-2800. Are you able to tell us who you are?
Hi, it's Angie from Alpine Pediatrics. I'm the Director of Behavioral Health and Case Management here.
Great, great, Angie. Gina.
Good morning, Gina Polamani, family advocate for Medical Home Portal and UCCCN.
Terrific. And I think I've got another Gina, Gina Everett. Let's see, they are muted. So if you're not able to unmute and you do have access to the chat, you're very welcome to use that.
So Gina Everett, she is a care coordinator at Utah Valley Pediatrics.
Terrific, welcome. Ileana.
Hello, this is Ileana and Janet from Southwest Children's Clinic.
Hi guys, welcome, welcome, welcome.
Hi, Illy.
Hi, Gabby.
And Jade.
Hi, I'm Jade with University of Utah Health Plans and Healthy U Medicaid.
Welcome. Janelle.
Hi, I'm nurse care manager for Intermountain Healthcare. I work at a couple of different clinics.
Wonderful. And Jocelyn. Let's see, I'm not sure you're on the phone. It looks like Jocelyn. I'm not sure if you can unmute. Okay. Jill Connor.
Good morning. This is Jill Connor. I'm the Director of Business Development at Shriners Hospitals for Children.
Good morning. And Kelsey Christopher.
Hi, I'm a URLN trainee in Montana, and I'm joining for my clinical observation hours today. So thanks for having me.
Welcome. We're glad it worked out. I have someone with just Linda as your name.
Linda Stevenson. I'm with Integrated Services in Central Utah.
Hi, Linda. Welcome. And Mackenzie.
Hi, I'm Mackenzie with Help Me Grow Utah. I'm a parent support specialist.
Welcome. Welcome. Michelle Redfield. See, Michelle, you're muted.
Yes, hi, I'm Michelle Redfield. I'm the new administrative assistant for the General Pediatrics Division, working with Mindy.
Glad you're here.
Thanks.
And Natalie Allen.
Hi, I am with the Utah Department of Health Integrated Services Program, Eric's group, and I'm a nurse practitioner.
Always happy to have you, Natalie. And Tony.
Hi, I'm Tony Estrada. I'm a care coordinator with the Integrated Services Program.
Welcome, welcome. And Walt.
Yes, good morning. Walt, I'm Walt, Integrated Services Program, a care coordinator in Salt Lake, and I'm with Eric's group.
Glad you're here. And then I see Angie was on the phone, but also on the computer. So we said hi to Angie already. That's great. And then I see another Michelle. Michelle might not be able to. I'm actually not sure how Michelle's connected, so that's just fine. Well, terrific. We're glad you're here. And again, apologies for anyone I've missed. We're going to just go ahead though and get going into our program today. So we do have, well, our usual housekeeping. The best experience on Zoom is on Zoom, not go to meeting. So apologies again for that. We'll make sure that you're really clear on the fact that we're using Zoom now, and we'll also take care of that passcode issue too. My goodness, so many problems this morning. My apologies. But yeah, we have an announcement from Shriners, our friends at Shriners, and so we'll go ahead and give them just a couple of minutes. Ooh, let me make that a little smaller so you can see this. All right, Dora.
Yes, thank you, Mindy. Can you hear me?
Yes.
Okay, perfect. Like I said, I'm from Shriners Hospitals for Children in Salt Lake City. So the seating and positioning program has extended care now. They changed it to Monday through Saturday, starting at 7:30 a.m. to 5:30 p.m. That's the newest news. And just as a reminder, what the seating department is, it's a seating department is the in-house custom seating clinic available to all patients with seating needs, and they customize wheelchairs for each child. They have been around building chairs specifically for pediatrics for 25 years. We have actually added one more staff member, so one more therapist, and they focus on just the wheelchairs for the children. And we also have 2 technicians that work side by side with the building of each chair. They customize it for all their needs. If they don't have something that they need, they customize it in the shop for the patient. They follow up 6 to 9 months with the children as they grow. It is very important that they make sure they're keeping up with the growth so that they don't miss anything that has, we don't want them to get any sores. So that's why we continue so often with the children and the growth for the chair. All insurance plans are accepted and care is provided regardless of the family's ability to pay. So even if they got their chair through any vendor, we invite the vendors to come to the appointment and they can work together. If a therapist wants to join in on the collaboration, they're also welcome to come to the appointment that they've been working with them. And then something that is very unique to us is our loaner program. We're fortunate enough that if they're growing out of a chair and insurance, it usually only covers every 5 years, but if they need to wait, they can build a chair while they're waiting for that to come through. So that's very nice. And along with the loaner programs, they have the Baby Bug, which it's a power bumbo that they've created, and they use it for the first 6 months while they're starting to crawl. They have the Go Chair, which is a chair that comes apart in 3 different parts. Not all families are able to move homes, so that's something that they're able to use while they're using, along with other programs. But if you have any questions, there's the information on there. And also in the chat box, I'll put my information, Jill Connors. If you have any other questions, or if you ever run into any bumps on the road or anything trying to refer, please contact us. Don't hesitate to contact myself or Jill. We'll be able to help you out. Thanks, Mandy. Or Mindy, sorry.
Okay, thanks, Dora. And we'll also make sure this information goes out in the summary of the meeting.
Okay, thank you.
Yeah. Okay, so we just wanted to make you aware of some updates with the medical home portal. Athena, I'll let you take it for just a minute, and if you want, I can give you control.
Yeah, if you can have me share my screen, that'd be great.
Okay. Or oops, almost had it. All right, there you go. Should be coming through.
All right, I just wanted to highlight an area, some pages on the portal that have been updated recently around screening for eating disorders. This is in the physicians and professionals tab. There's a lot of great information in here about screening for eating disorders. And then in addition, we've also, as part of the revamp of this page, have added several new service providers to our directory around eating disorders counseling. And this list will go out with the notes as well, so you don't have to worry about writing these down frantically or anything. So they are included here. And then just wanted to remind everybody that as you're searching the directory, you can use a key term search, but also category key terms. So if I was looking for information around eating disorders, as I start to type it, you can see that this category of eating disorder counseling comes right up. And I can click search, and it's going to give me a list of all of them, plus this nice little map feature where I can zoom in on maybe the area I'm looking at. And that's it.
Thank you. All right. So let's see if I can get back to my screen. Okay. We also had a few content updates we wanted to make you aware of, actually some new content as well. So we have an evaluation of developmental delay page that's out there now, and also evaluation for suspected Ehlers-Danlos syndrome. So you might want to check those out there. You can find those by just searching in the main search bar. They're also located in our For Physicians and Professionals section. And we have updated our newborn disorder page on carnitine uptake defect as well. And then just a heads up that we've started a relatively good sized project of updating the care notebook, which is a very popular page and item on the medical home portal and the family side. And so that's more to come on that. And hopefully we'll have a nice update for you regarding that in April. All right, so we are a little short on time, but we definitely don't want to overlook our brainstorming time. So if anyone would like to speak up, this is a great time for letting us know of any difficult cases you're experiencing and see if anyone else can help. Also, if you have any new resources you've come across, if there's been any opportunities for quality improvement or motivational interviewing, we'd love to hear about those.
This is Eric. I wondered if I could just ask a general question from our pediatric practices out there, some of our Utah Valley folks and some of the others who are specifically in practices. Have you folks noticed a decline in children coming in for well child visits and getting the vaccinations that they need that would go along with those well child visits?
Eric, hey, this is Angie from Alpine Pediatrics. We definitely have experienced that, and I think it's across the board for all practices. I think everybody's down about 25%, and we've made efforts in our practice to reach out to people whose well exams are due to try to keep our kiddos up to date, as well as developing strategies for limiting who's exposed to whom, when they're in the clinic. But yeah, it's definitely been down since the pandemic.
As a follow-up question to that, Angie, have you found that making those follow-up calls and trying to help, allay concerns or whatever, is that working with the families that you're serving?
Absolutely. I think part of the problem that we've come across is that, we've got people because of the pandemic that have not reached out when they normally would have, and they've needed kind of that extra reassurance. Yes, we are seeing patients, And this is how we're doing it. This is how we're, acknowledging the pandemic and the, the practices that we put into place to keep you safe. So absolutely.
Thank you. I appreciate that.
Yeah.
Thanks, you guys. Anyone else? Does anyone want to give us an update on getting vaccinated or how things are feeling with spring and vaccinations moving ahead in your clinic, in your organization? I was able to go get my first one at the hospital, I don't know, a little bit ago. And the greeter who was helping direct traffic said, "Welcome to the happiest place on earth."
I wondered if I could just ask a question, kind of a follow-up on an email that went out to the group about housing assistance. That I saw, Mindy posted a question from, I think it was Pat Rowe, if I'm not mistaken, and all sorts of people hopped on with some great, helps and ideas there. I just didn't know if there was success in helping keep that family from getting evicted. And is Pat on our call this morning? Okay. Have you guys just generically, as you've worked with families, had those worried about losing housing type issues and concerns? I know nationally, I listen to NPR in the mornings, and they've been talking about people facing eviction, and a lot of people are grateful that there's some sort of assistance out there. I didn't know if just generically, as you're working with families, if you're running into that fear of losing housing once again, like we did, last year at some point.
Maybe not so much. Well, please feel free to use the chat too, if that's accessible to you, if you'd like to make any comments in there. That's a good question. That was a sad email that came through from Pat, and I hope things ended up okay. They were just so close to Monday and the date for some of those changes to be put in place with regard to evictions and so forth. That's a good opportunity for me just to remind you guys that we do have that listserv, and it's really for you guys to use in between these meetings for the situations just like Pat. You're welcome to post to it directly. Oftentimes someone will send something to me first, and then I'll send it out, and I'm happy to do that. That's great too. However, if you do have that address, and it's in the it's on the last slide of the meeting slides, and I can also make sure it's in the summary of the meeting, but you're welcome to post directly to it. There's no barrier for that. So we enjoy staying connected in between meetings, and that's really what a big part of what this group is all about, is supporting one another when we can. All right, well, this again, I don't want to cut this time short. If there's anybody who has anything else they'd like to bring up, you heard that Gabby is with the UPIC folks, and they're all about quality improvement. I just wonder if anybody's working on any quality improvement projects, big or small.
I just want to give a shout out to the Southwestern Children Clinic. They are participating in the asthma project, and they have a new care coordinator, Janet. She's on the call today, and she has been very engaged and has improved the ACT screening or asthma control screening to almost 100%. So she has done very well with her clinic. I just want to say thank you, Janet, again, and it is a pleasure working with you.
Thank you, Gabby.
Yay! My camera's not working, but you'd see us going, yay!
See what happens when you guys do quality improvement projects? You're so happy. It brings great happiness.
We're excited. We're excited to have Janet here, and we're working hard.
That's great, you guys. Wonderful. All right, well, if there's nothing else, we'll go ahead and move into our main part of the meeting. And I am delighted that I see both Margie and Cheryl on the call. You guys missed all of the excitement at the start of the meeting where many of our participants got the wrong connection information. So I'm so glad that Margie and Cheryl were able to connect in without a problem. And if it's all right with you guys, I do have your slides right here, and I'll be happy to just move through them when you let me know.
Perfect. Thank you so much. Thanks to all of you for having Cheryl and I be one of your speakers today. So I appreciate that, and I do appreciate you moving that slide ahead for us. So when I was preparing for this, I was kind of just looking at this slide that you're all looking at right now and realized that the title slide, right there. And I realized that as I have worked with the association for the last year and a half, I've come across people that are very familiar with the family support centers throughout the state, and others are like, I've never heard of you. I really wish I knew about your program before. So, so I'm the executive director for the Utah Association of Family Support Centers, which is the umbrella organization for the family support centers throughout the state. So what we're going to do today, both Cheryl and I, is introduce you to family support centers, to those of you that don't know about them. And for some of you, this will kind of give you an overview of the programs we have throughout the state. Next slide, please. So the Utah Association of Family Support Centers, UAFSC, our goal is to prevent child abuse and neglect by supporting parents through times of crisis and providing them the tools to ensure brighter futures. In a little bit, you'll hear from Cheryl Goody, who's the executive director of the Family Place, which is our center in Logan, but she also represents the Cache Valley and is a mentor to many of our other executive directors. Okay, so what is the Utah Association of Family Support Center? So we are the umbrella, as I said, of the family support centers throughout the state. And we have 11 family support centers throughout Utah, including 17 crisis respite nurseries. And I'll go through the slide and explain what that all means to you. What we do is we really focus on prevention. We try to prevent child maltreatment and enhancement of child and family well-being. So we're 24-hour respite. Those 11 centers are 24-hour crisis respite nurseries. We serve children from infancy to 12 years old. We give them a place to stay if there's a crisis in the family, or parents or caretakers just need a break. That's where the respite part comes in. Now, what I have listed here are some of our core services. Every center has that crisis respite nursery. They have information and referral services. We do have therapy at most of our centers. I will say that for those that don't, they have a very strong partnership with their community partners, and they can refer out for therapy. We all have parent education. We all have parent strengthening activities. Next slide. So here's the coverage, and this might be a little bit hard for some of you to read, but if you're in gallery mode, but you can see the list of the support centers throughout Utah. And this map illustrates, thank you, this map illustrates the coverage, which you can see is the entire state. So, for example, let me show you Cache in Rich County, in the corresponding color, and you see it right there. And Southwest Utah is all of this part of our state. The Salt Lake centers cover Summit and Tooele County as well. Next slide. Okay, so I talked a little bit about those core services, and you can see here the list of our family support centers here on the left, and that's the 11 centers and what all of them do provide, to talk about that. So when you go to the center, you can expect that children would receive these services. Next slide, please. And there are some additional services that are offered at the center. So you may see, I mentioned the professional counseling. That means that they have a trained therapists within their facility. They have shelter. Most everybody has shelter contracts. And what that means is if the child is removed from the home through the Division of Child and Family Services, we would take those children into the crisis respite nursery area and shelter them until placement is found. So case management, that's kind of a broad statement. I think every center does case management, but some of them are more formal in that they'll work with the family so that the family has a comprehensive treatment, if you will, plan to be able to get back on their feet. We do adoption, respite, and foster care respite, which means that some of the centers actually have agreements with state organizations that will have specific programs to help that population. So, and then the self-sufficiency programs for adults in our centers in Salt Lake, we actually have Life Start program, which serves children, mothers and children, fathers too. It has a full treatment program and a live-in facility. So basically, what I also wanted to mention is that with those 11 centers, some of them have been around for decades. Every center has their own executive director, and they are trained to work with children and families that have experienced trauma. We're not daycare. We have a very therapeutic approach to our programs. Each program is also a independent 501c3, so they all are their own nonprofits. The association, of which I manage, has a board of which we don't really get into the program, managing the program operations of these centers, but we do look at the overall statewide network and provide support to the centers. Next slide, please. So I did mention that each one is a private nonprofit agency. They each have their own board. They have their executive directors and their staff of which they manage. So their boards are governing boards, just as the association is for the association. So they are really, really geared at prevention. As I mentioned, they really work towards strengthening families and preventing child abuse. Every center has state licensed. They're available 24 hours a day, 7 days a week. They help families during high stress and crisis, and they offer support, referrals, crisis, respite, nursery, and education. And just to kind of give you a practical example, if you were to work with a family that is tell the parents just need a break, that they're really just very stressed, that you're really concerned about the child and the parents' reaction to the child. You maybe even be concerned about the child being abused because the parents have just kind of reached the end of their rope. That's when a family support center can help you. You can refer the parents or the caretakers to one of our family support centers just to have to leave the children there in the nursery and to allow them to take a break for 2 hours, 2 to 3 hours. While the child is there, the program is really structured, and I'll let Cheryl talk about that a little bit more. It's structured. They can come more than just one time. You'd be amazed at how much it helps the caretakers relieving that stress and getting back to their children with a new attitude. So we have found it to be very effective. Next slide. So that photo that I have there, that is the support center in St. George. So when we talk about a home-like environment, most of our programs are in homes like that, houses in that. We have a couple of centers that have their crisis respite nursery within a building, and which you'll see in Cheryl's presentation. The same is true for Orem. Our program in Orem is a building, but the nursery part of it looks like you're in your home. They have bedrooms that are decorated for children. So a play area and a comfort corner, which Cheryl will speak more about. That's a review of some of the information I already gave you. Next slide. Okay. So how are we different? Well, we're not a daycare. We really have a therapeutic approach to our treatment and our care of children and families. They're free. They don't cost families anything. They have, we may feel, as I mentioned, you may feel that the child is at risk of abuse or neglect. There's a crisis in the family, an emergency. Maybe a grandmother is sick and mom and dad or caretakers have to go and take care of grandma for a little bit, and they'll leave the child there for care. And it could be longer than those 2 hours if it's a family crisis. They just need that break. They're stressed. They need a little time off. I think that a lot of our caretakers' parents use the family support centers for things like medical appointments, treatment. They may go to a substance abuse group activity, look for work, maybe have to see a doctor themselves, or go see their lawyer. This provides that time for them to be able to take care of their personal needs. Next slide. These are just some of our stats that from last year, the number of families that have received information and referral from our centers, the number of visits, volunteer hours, and you can read that on your own. So the total hours that we work with children are about 156,000 hours. Next slide. This beautiful center right here is the family place. Cheryl is the executive director of the family place. It's a very dynamic center in Logan. It really is a model for our type of program. So I'm really excited for her to tell you more. They also have centers in Smithfield and, I just lost it, Cheryl. Help me.
Hiram.
Hi.
And Hiram.
Hiram, thank you. I apologize. I'm just recovering from COVID, so I have a little bit a little bit fuzzy here for a little bit. But family place is great. I look to the family place and I look to Cheryl for guidance for our other programs. And so I'm excited to introduce Cheryl to you to continue the presentation. Cheryl, I'll let you go ahead.
Thank you. I'm excited to be here with you today and to share what we do, because you all also do amazing work. And so being able to partner with you and to share those resources is essential for our communities, for our sweet families that are just trying to survive during this time. You know, and so I wanted to talk a little bit about how COVID has impacted children and families in our communities and what we've seen, because we know parenting is hard, right? Families don't come with an instruction manual, and especially as parents are working from home, kids are often doing school from home. There's added financial stresses, employment issues. And what we're finding is during this time that families are feeling little to no support during parenting challenges. So maybe I'm just having a hard day. Well, I don't know. I think parents have a hard time every day. You never know what you're going to wake up to and what your day is going to include. And so we want to be there during just those daily things. What a crisis is for one family or one parent can be very different for another. It might be something major, needing to go to a hospital, maybe needing to go to an appointment, but maybe a parent just needs a break. And that's what we want to provide, is that break. That's what, for us, child abuse prevention is being there to provide that free therapeutic childcare. We're not going to put them in front of a video. We're not going to give them video games to spend some time with, but we're actually going to help them work through some emotions, help them to work on that self-regulation. I often think of our crisis nurseries as being a chance to return those children better than we found them, and send them back to their parents with a few more skills that they can help mom or dad or whoever that caretaker is to be able to work through some of these hard times. So I want you to remember that our services are free, and not just free to low income, and not just free, excuse me, to certain populations, free to everyone. And again, that crisis, that time of need is determined by you. We want to let parents know that they're doing a good job. You know, I think that we often do various jobs, just like the one that we're sitting in right now, because we're going to feel that reward. We're going to feel appreciation from those that we work for or work with. But there's little appreciation in parenting, and we need to be that support for them and giving them confidence and other resources in the community that can help them, not just during this time, but always. As I talked about preventing child abuse, that was really the cornerstone of why we were developed. And prevention for us comes in a variety of ways. As I mentioned, the crisis respite centers that we have, but also through parenting education. We offer various parenting classes to help give parents more tools. We have found that as we teach about discipline and teach about helping children to communicate better, parents often say, I wish I would have known this earlier. All I had to go off of is how I was taught, right? That's how we learn to parent, is from those that parented us. And sometimes there's better ways, and they just need a menu of different tools that they can fall back onto. We have step parenting classes at some of our facilities. We teach child development, help children actually through parent-child bonding activities, therapy and workshops and groups to be able to help them where they are in their journey. I also wanted to share with you, because I have a feeling that you deal with something that we often see, in our own staff, and that's secondary trauma. The jobs that you're doing are hard, and I want to remind you about the importance of self-care. What are you doing to let go, to increase your energy after a long day, to rejuvenate? We help our staff by debriefing. We often have situations that are very confidential, but we encourage our staff to talk together, to be able to just to vent about it is often something that can help decrease that trauma so that they can release it before they need to go home to their own families. We also do a lot of mindfulness training, and I encourage you to seek out, there's so many free things. There's Headspace apps, different things just to let your mind go, to let go of these challenging times. We all are considered trauma informed in our family support centers. We've had a lot of training to deal with those who have undergone various traumas. And we help children and parents dealing with trauma by helping them to regulate their emotions. In our crisis respite center, we do that with various activities using sensory items, even art, and helping them just to communicate and understand how that energy inside them feels, what they can do to regulate that on their own. We've had children as young as 2 and 3 come up to us and say, my energy is high, and they are feeling uncomfortable, and we're able to help work off some of that energy instead of throwing a tantrum. And we also have, Margie mentioned, we have comfort corners in our centers, and that's just a place for them to take a quiet break. It's not a timeout. It's a
Mindy,
time
could
in.
you go ahead a couple slides? I think that we have a little photo of some of those. Next one.
There you go. Just a place for a child to step aside with one of our well-trained staff members who is able to help them release some of that energy, to be able to take a step back and then be able to re-enter. And it's a great skill as a child and even as they move into adulthood. And this is something that we even encourage our parents to have in their homes, just a place to kind of quiet down. We have soft and inviting places for them to relax, help them to clear their mind. Any questions or anything on some of those things that we do in our centers and what a good referral might look like for us from the parents that you see?
Well, I'm going to ask in another way too. Do you think that in your work, do you find the opportunities, or do you ever work with parents that you feel like just need a little break, or that you feel that they may be in crisis? Does that happen in your practice? Is the Family Support Center an option for you, or a possible option? Mindy,
well, I hope that you'll keep our numbers available and refer parents if that might be something that they might find useful, because it might be even at 2 in the morning, and we have 24-hour, 7 days a week crisis lines to be able to refer people to other resources, but also we have a commitment that we will be to our centers within 30 minutes to receive children in case there is a crisis, even in the middle of the night, because you never know when that baby won't quit crying, when you've had it, you have a big presentation in the morning and need that break to keep your children safe. And we are very non-judgmental, and we want to be there for families.
So I
Sure.
have a,
Go ahead, Mindy.
yeah, there's a question that came up in the chat, and I think it's very relevant to this group. So, you know, many of the families that our care coordinators and folks on this call support are raising children with special health care needs. So I would assume that kids with special needs are welcome at the family support centers. How do
Yes, they are.
Yeah, how do you go about helping kids who might have some particular medical issues or behavioral issues?
Behavioral issues are our specialty. We do well with big behaviors, and we even have what we call a red break room where we're able to separate to keep a child and other children safe if there was a big tantrum or anything, to be able to allow them to break down that energy and to help talk them through that. As far as medical needs, we do have a few limitations there. We do not have someone staffed that is able to give an insulin shot or something like that. But for the most part, we are able to take children, for example, with disabilities or with extra challenges like ADHD or autism that we have been trained with.
Very nice. And thanks for that question. Any other questions? This does make me think of an instance, and yeah, so I ran into somebody in my non-work life who is a great grandmother to a 2-year-old who has some behavioral issues going on. So she's now raising this great grandchild, and there's suspected autism, and they're working on getting a diagnosis. But I know that that's just been an enormous challenge for her. And so I'm immediately thinking about this for her when she's going to need a break, because it's going to be she's going to need a break for sure. So I think she might be able to learn a great deal about some tools that you mentioned to put in her toolkit as she takes on this new challenge. So I can immediately pass this along to someone that I know. Anybody else? Have you guys been familiar with the Family Support Center system and program in Utah? And you're welcome to put it in the chat if you prefer.
This is Cheryl, and I'm practiced down in American Fork. So I had a mom who called DCFS on herself. She had not abused the children, but was worried that she was going to. So we referred her to the Family Support and Treatment Center in Orem, and she's had an excellent experience there.
They have a great program there. Thank you for sharing that.
Yes, hi, this is Walt up in Salt Lake, and I've used the program for several of our families that we've had. And thank you, you've saved the families. Thank you.
So Walt, I'm guessing you used one of the Salt Lake facilities.
Yes. Mm-hmm.
Yeah, great. You want to Mindy slide down just a couple of slides. Cheryl talked a little bit about COVID and the impact that it has on us, not just COVID right now, but just that secondary trauma you may feel by working with difficult families that have challenges. The next one, Mindy. When we initially were looking at the possibility of some, make this a little bigger for myself, a little bit, we were looking for funding that would help us during the COVID time. And we did a survey and discussions with our executive directors to see how COVID has impacted the staff and their services. So these were some of the findings that we found. And what I found so interesting is that when we presented these to the executive directors, some of them were really surprised by the results because they didn't realize that maybe their staff was experiencing some secondary trauma, and it made them aware of some of the needs that were unique in the COVID environment. And even though we're coming towards what seems to be a recovery for all of us, I think, and moving on to normalcy, some of these still will affect us, and they've changed the way we've done services. So, in our nurseries, we've had to comply with the social distancing. So the nursery sizes are smaller. They sanitize the nursery before and after care, which I'm sure many of you are doing as well if you're in a practice. We're finding that there is sadly an increase in what we're seeing as a child abuse in the state and domestic violence. But what we see at the centers are families that are stressed. So we have expanded our shelter coordination with the state so that we're able to take children in a very rapid manner, place them in our shelters until additional care can be available for them. So in-person community parenting classes, what we call our parent education, were canceled. So we had to find a different way to present parent education, and that was virtual. Well, that sounds really like a great concept, a great idea, until we realized that some of our families didn't have a computer, didn't have a device to be able to communicate with the center. So we were able to purchase devices that they could check out. And we also found that there were families that had cell phones, but they bought their minutes by the month, and they were limited. So they had to make decisions on what was more important. Was it to have those minutes available for family and family emergencies, or for counseling, or for parent education? So we've had to make adjustments with that and with face-to-face therapy. Some of those I think Cheryl will probably implement ongoing. And I know that Cheryl serves Rich County as well. So a lot of that is done remotely. Okay, there was a question I want to address here about those in Salt Lake. The reason the Salt Lake centers don't have a shelter is that we have a community partner that actually has they're specialized in shelters, the Christmas box. So we will send shelter children there instead of the Salt Lake Center. Orem does have the shelter facility, by the way. So staffing, Cheryl really addressed that. Please remember to take care of yourself. We have found we were able to put money toward respite and hazard pay. It provided mental and emotional health support. Secondary trauma is true. We're concerned about long-term post-traumatic stress disorder. Fundraising has definitely been affected. Our association board is well aware of that. And is really focusing on trying to raise funds that would benefit the entire state. We were just recently awarded $2.8 million from the state TANF funds. So we were really excited about that. Okay, Cheryl, I'm going to let you field this next question, which is also a very good question. When a parent takes a break, is there any danger of DCFS referral if a parent asks? Sorry.
Great question. So as I said, we are non-judgmental and we're there to help, but we are required to report if child abuse has been reported. But in that process, we do let the parents know. It's not a secretive thing, that this is what has been disclosed. And so that is not our intent. Our intent is to help to prevent that by being there for them before it happens. But that's not our intent, is to turn them in.
Thanks for that good question. I like that one. Any other questions? I was showing you the slide just for illustration. I do want to say that I think that our reactions, our response to COVID has changed. We've adapted to the changes of the restrictions. We have really, there was a period of time when we first all heard about COVID that parents thought we were closed. And so with a little outreach, we let them know that we were open. The reason we're open is that we are considered essential services. We were really not allowed to close. We are important to our community. Our centers are important to our community. Our staff are essential workers, just as many as you are. So I want again to ask if there are any questions where we have. I know we have some time, Mindy. If not, we can.
Oh, yeah. I think the thing that's coming into my mind is just asking our group here, you know, do you feel like this is something that you could pass along to the families you work with in a way that communicates that this is non-judgmental, it's there as a resource, it's there to help? I know that I sure would have appreciated some parent education classes when my kids were young. But I don't know if there's a stigma that seems to accompany that, or if that would be something people would listen to with open ears. I'm just curious to know from our group here, their thoughts on sharing this information with the families they work with. McKenna says, yes, we use the service often as a referral when our families mark positive on the screening tool for social determinants of health for increased stress. So she really appreciates the difference you're making in the community. Great, great.
Thank you, Jocelyn, for that comment too. Appreciate it.
I'll just say one other thing. You know, we have been talking with this group for a while now about trauma and, you know, stress, ACEs. We've also had some meetings around mindfulness and self-care. But I think this is really important to recognize that we need to be listening with the families we work with about, you know, for some of these key things that might indicate stress and trauma and so forth, being able to talk about feelings, being able to self-regulate. I think that's equally as important for adults as it is for children. And so if we're able to say and talk with our coworkers, and I was saying to my kids the other day, this is hard. And I think my kids thought I was complaining. And it's really important, I think, to recognize there's a difference between acknowledging that something's hard and then, you know, complaining. And so if that's something that we can work on for ourselves, it's good to acknowledge our own feelings and be able to then process them and still go on and take care of, you know, our work issues and our family issues and so forth. So I really like what you've got here.
Thank you. Mindy, it reminds me of, you know, when I have visited the centers and talked to some of our staff, the center in Roosevelt told me a story about a group of parents that came to the parent education class. And the instructor generally they come to the class and they're very closed off. Most of them are a court order to be there. So they had the staff, not only the staff member in Roosevelt, but throughout the state have learned to work with families to be able to help them feel more comfortable in those settings so that they will come back. to the parent education class over time. And she said week after week, they become more comfortable. And as they move along, they begin to share. And she said it's amazing to watch the transformation. I really love that about our parent educators, because they really do know how to reach parents and to disarm some of their hesitations and their apprehension about being there, and working through those weeks of classes so that they become better caretakers. And we do a pre and post survey to measure their attitudes toward their children, the relationships with their partners, to see if we have actually made an impact, and we see really good results. The other story I wanted to share is the Gero Center with the children that are in their little comfort corners, and how they almost sometimes teach parents to get in touch with their own emotions based on their experience in the comfort corner.
Yeah, that's really excellent. It made me realize I created my own comfort corner as a kid. So
Really?
yeah, I think everybody needs one of those. So that's really great. No matter what your age. So that was a really neat takeaway too. Yeah.
When I first introduced that concept to the board, they're all like, "Oh, we want one of those in our own home." That's great.
Indeed.
Oh, one other thing I was going to ask Cheryl to maybe mention is, if you notice in that the slide with the comfort corners, they really are very purposeful and thoughtful about the toys and books that they buy. And I wondered, Cheryl, if you could maybe just give a little bit of feedback or on why you purchased those, and maybe even if you buy when COVID is restrictions are lifted and kids can play and read in some in a waiting room, maybe you can think about purchasing some of these types of materials and supplies in your own practices.
So as far as our comfort corners but more importantly, your waiting rooms, we have found that our favorite toys for young children that are easy to clean because of COVID guidelines, they are little people. So those small, I think they're Fisher Price, and there's a variety of characters. They're easy to put into a sink of hot water and soap and clean up, because we have found that even like our wood toys, our wooden ones, they don't stand up to the harsh cleaners. Books are challenging. And so I think that that's something that you'll have to look at and what you're comfortable with. But when we do have books available for our children, we look for those that talk about emotions, that talk about different types of families, that talk about feelings, because that opens the conversation for something that they might be going through at that time. So it's really to open that conversation and to allow them to feel safe to have that discussion with one of our staff members.
Great. Well, if you by any chance have a list, and I'm sure you're busy enough that you may not, but if you do and you'd like to share that with us, we can send that out to this group too. That's terrific. Thank you very much. Does anyone else have any other questions? Comments? And Mindy has said that they've referred a lot of families for counseling in the Orem area, and not so much for childcare, but she can think of many families who would benefit. So she's grateful for this information.
Yeah, they did good work there, sure.
Well, I think this is terrific. Thank you very much. It's really great to know that this is available, you know, during COVID. We'd like to think that we're coming to the end of it, but I feel like I'm getting that secondary trauma on a daily basis when I read about something new that might prevent us from getting through this as quickly as we hope. So it's wonderful to know that regardless of what's happening in the larger world, you guys are there. And are there any materials that you might have to be able to hand out to families? Is that something that we could request?
Yeah, definitely, Mindy. And I'll forward that to you, as well as a list of the centers.
Great. Very good. All right.
And I would encourage you to reach out to the family support center that's in your area. Yeah. And as we do start opening up, I would encourage you to take a tour. I think that's the best way to make that warm referral is, I've been there, I've seen this, I've met the staff, and I think you're really going to like it. And each of the centers have a website. So if you just plug in Family Resource Center in the area you live, it'll come up as well. But do arrange visits. Oh my gosh, it really changes your perspective on our care in the state of Utah. So good work being done there.
Oh, that's fantastic. And we have all the Family Support Center locations listed in the Medical Home Portals Utah Services Directory as well. And we'll make sure that those links go out in our summary of the meeting too. So lots of ways to find these guys. And I love the idea of taking a tour. That's terrific. All right. Well, I think that we're kind of at the end of our meeting then. Give you guys a few extra minutes to celebrate St. Patrick's Day in some way, shape, or form. It is a beautiful day, at least where I'm at. So maybe you can take a quick stop outside and look at the day. Our next meeting will be April 21st. And just a reminder, as I mentioned earlier, that we have our listserv, and we love to see things come into that listserv between our meetings to keep us connected and to support one another. So if you're having concerns or questions or want to share something, that's an excellent resource for you. And as always, take care of yourself, both in all the ways, but try and stay safe and healthy as we try and get through this now over a year of a pandemic. So, thanks everyone. It's always good to see you. And again, we'll be following up to make sure there's good Zoom links on your calendars for the next meetings. Thanks again to Margie and Cheryl for your time this morning. And we'll see you guys next month. Take care, everyone.
Thank you.
Thank you so much.
Bye-bye.
Thanks a lot.
Mindy, quick question for you.
Sure.
Do you want me to link all the family support centers in the directory, or just the overreaching one?
Probably just the overreaching one.
Okay, perfect.
Yeah. Okay. Yeah, I was thinking about that too.
I did that one, and then the family place in Logan, the one that she was representing. So
great. I think that's great. Okay. All right, guys. Well, it wasn't quite as smooth as I'd hoped, but we got through it. And I will sign off and stop recording. So see you guys later.